How well you handle pain could be in your DNA.
And doctors are still prescribing some codeine to children despite recommendations not to. CBS News' Lisa Sigell is here now with today's Health Watch. Lisa.
Hi, you guys. Hello, you two. Hi, everyone. Well, for years, the American Academy of Pediatrics has warned of the potential dangers of prescribing the painkiller and cough suppressant codeine to children. But a new study finds far too many young patients are still being given the drug.
Open, say, ah.
New dad Wesley Johnson asks a lot of questions when his twin boys are prescribed any medication.
Any medicines like that, I think we'll have a thorough conversation with our doctors about it. This research as much as possible. Being parents, we just don't want to give our kids anything.
A new study published in the journal Pediatrics finds some emergency room doctors still prescribe codeine, even though guidelines warn it can be dangerous in children.
Absolutely, potentially harmful. Children are definitely different from adults whenever we give them medications.
Codeine is an opiate prescribed for cough and pain. The study found it can help some children, but about a third get no relief, while others can build up toxic amounts, causing excessive sleepiness, difficulty breathing, and in the rarest of cases, death. The FDA warns it can also trigger rare, life-threatening complications after some surgeries. Dr. Peter Waldstein says it isn't worth the risk and says there are safer alternatives, especially for a cough.
Good old honey. Honey works, and as far as pain relief, ibuprofen.
Pediatricians advise for more severe pain, hydrocodone is a safer, more effective option. And Wesley Johnson says he'll just steer clear of giving his boys any medication without checking with a doctor first. They are too cute. The study also says emergency rooms, clinics, and hospitals should reduce the amount of codeine prescribed to children. And also in Health Watch, your tolerance for pain, well, it may be in your genes. Researchers studied people with different degrees of chronic pain. They found patients with a certain variant in their genes could tolerate higher levels of pain. Now, scientists are hoping their findings will lead to new gene therapies for pain management. And finally tonight, an estimated 1 in 68 children are diagnosed with autism. Now, a new effort is underway in Southern California to diagnose and help those children as early as possible. Today, the organization Autism Speaks and 211 LA County, along with doctors, families, and political leaders, teamed up to call for earlier intervention. Experts say early detection is critical, but autism often isn't diagnosed until age 4 or 5.
It's going to take a concerted effort between agencies and organizations to make sure that we reduce this diagnosis age. We have to be closer to a year old, to a year and a half old. If we're not doing our jobs.
And autism is often diagnosed later in poor or minority communities. Asner says we owe it to those with autism to get them help as early as possible. So the bottom line here is the earlier the intervention, the better the outcome for the child, as we know.
All right.
Yes.
Thanks, guys.